So I knew I wanted to be a healthcare provider of some kind ever since high school. It was after a football injury that I ended up in the athletic training office, and I found out that it was a lot more enjoyable to be on that side of things than out on the field getting pummeled. And so I had made a decision pretty early on that I knew I wanted to do something in healthcare. There are so many things that bring me joy about being a physical therapist. It makes my brain work in just the right way. I do have ADHD, something that I've struggled with for a long time, and patient care is something that really lends itself to that. Every hour I've got somebody new coming in trying to fix a different problem. It really allows me to stretch my legs and help people solve problems. I really enjoy figuring out a puzzle and coming up with a solution. And built into all of that is all of the warm fuzzies that you get from helping people feel better. It's just great. I believe that my patients know their bodies better than I do. I've got a lot of education that tells me about broad anatomy and generally speaking how things work in the body, but everybody's a unique individual. And so if you don't have the time to listen to them, you're going to have a really hard time figuring out where to go. I've always believed that if you listen to a patient long enough, they'll tell you what's wrong with them. But if you have time to keep listening to them, they might even tell you how to fix the problem too. I'm never going to be the source of somebody's recovery. My key role is to provide education. I've got a lot of tools in my toolkit. I can absolutely help decrease pain, I can help facilitate a muscle to contract, but ultimately everything I do comes down to two things. I'm managing blood flow. I'm either getting more blood flow to help that area heal, or we're helping take some of that away so we don't get as much swelling to the area, or I'm helping your brain pay the right amount of attention to something. If it hurts, well, your brain's paying way too much attention to that and you need to ignore it. If you're not using that thing particularly well, we got to figure out how to plug your brain into that muscle so that you can use it better. But ultimately, it's your body that's doing all of the hard work, and it's my job to just kind of point it in the right direction. The longer I've been a physical therapist, the more I've learned that the foot bone is connected to the head bone is a saying for a reason. Biomechanics is another specialty of mine, where you can really take a mechanical approach to treating the body, where if you can analyze how somebody's moving, you can really pick apart all of the little places where that thing could be going wrong. Being able to connect those dots is just one of the most exciting things about physical therapy, because there is absolutely a roadmap to getting better.